Hi, this is Kelsey from Inspired Elite Solutions. Today we are going to go over the stages of change. As we read through this together, I want you to keep in mind whatever the addiction or problem is in your life that you're here to change. At the end, I will ask you to write a summary and kind of identify where you believe you're at and where you need to go, maybe to move through that cycle of change. Go ahead and open up the PDF or print it out. The first part shows it in a wheel form, the stages of change. It starts with pre-contemplation, then contemplation, preparation, action, and maintenance. I'm going to read through this with you so you can take notes and follow along. Between the stages and the cycle through the stages at different rates. In one individual, this movement through the stages can vary in relation to different behaviors or objectives. Individuals can move through stages quickly. Sometimes they move so rapidly that it is difficult to pinpoint where they are because change is a dynamic process. It is not uncommon, however, for individuals to linger in the early stages. For most substance-using individuals, progress through the stages of change is circular or spiral in nature, not linear. In this model, recurrence is a normal event because many clients cycle through different stages several times before achieving a stable change. The 5 stages and the issue of recurrence are described below. Now the first stage, pre-contemplation. During the pre-contemplation stage, substance-using persons are not considered change and do not intend to change behaviors in the foreseeable future. They may be partly or completely unaware that a problem exists, that they have to make changes, and that they may need help in this endeavor. Alternatively, they may be unwilling or too discouraged to change their behavior. Individuals in this stage usually have not experienced adverse consequences or crises because of their substance use and often are not convinced that their pattern of use is problematic or even risky. The next stage, contemplation. As these individuals become aware that a problem exists, they begin to perceive that there may be cause for concern, and reasons to change. Typically, they are ambivalent, simultaneously seeing reasons to change and reasons not to change. Individuals in this stage are still using substances, but they are considering the possibility of stopping or cutting back in the near future. At this point, they may seek relevant information, reevaluate their substance use behavior, or seek help to support the possibility of changing behavior. They typically weigh the positive and negative aspects of making a change. It is not uncommon for individuals to remain in this stage for extended periods, often for years, vacillating between wanting and not wanting to change. The next section, preparation. When an individual perceives that the envisioned advantages of change and adverse consequences of substance use outweigh any positive features of continuing use at the same level and maintaining the status quo, the decisional balance tips in favor of change. Once instigation to change occurs, an individual enters the preparation stage, during which commitment is strengthened. Preparation entails more specific planning for change, such as making choices about whether treatment is needed, and if so, what kind. Preparation also entails an examination of one's perceived capabilities or self-efficacy for change. Individuals in the preparation stage are still using substances, but typically they intend to stop using very soon. They may have already attempted to reduce or stop use on their own, or maybe experimenting now with ways to quit or cut back. They begin to set goals for themselves and make commitments to stop using, even telling close associates or significant others about their plans. Next is the action stage. Individuals in the action stage choose a strategy for change and begin to pursue it. At this stage, clients are actively modifying their habits and environment. They are making drastic lifestyle changes and may be faced with particularly challenging situations and the psychological effects of withdrawal. Clients may begin to reevaluate their own self-image as they move from excessive or hazardous use to non-use or safe use. For many, the action stage can last from 3 to 6 months following termination or reduction of substance use. For some, it is a honeymoon period before they face more daunting and long-standing challenges. Next is the maintenance stage. During the maintenance stage, efforts are made to sustain the gains achieved during the action stage. Maintenance is the stage at which people work to sustain sobriety and prevent recurrence. Extra precautions may be necessary to keep from reverting to problematic behaviors. Individuals learn how to detect and guard against dangerous situations and other triggers that may cause them to use substances again. In most cases, individuals attempting long-term behavior change do return to use at least once and revert to an earlier stage. Recurrence of symptoms can be viewed as part of the learning process. Knowledge about the personal cues or dangerous situations that contribute to recurrence is useful information for future change attempts. Maintenance requires prolonged behavioral change. By remaining abstinent or moderating consumption to acceptable targeting levels and continued vigilance for a minimum of 6 months to several years, depending on the target behavior. Next, I want you to read through recurrence. Pause the video. After reading through recurrence, read through triggers to change. Pause the video. Now that we've gone through the 5 stages of change, I want you to think about where you are and where you need to go from here in order to actually continue in this cycle for success. Go ahead and write a summary of what you've learned, including your thoughts about where you are today. Thanks for watching.